So the question of whether to have a patient undergo a repeat biopsy after their cancer progresses on targeted therapy is a really important one, and one that's something that we discuss often for each particular patient. In many cases, a repeat biopsy at the time of progression on EGFR inhibitors or other targeted therapies can be very important. And I think it's mainly for one reason clinically, and many reasons for research purposes. So clinically, I think it's really important to know what's happening at the time of progression, because in some patients, the cancer changes from a non-small cell lung cancer to what's called small cell lung cancer, which they're both types of lung cancer, but they act very differently, and they respond to different treatments very differently. So it's important to know if the cancer has changed from this non-small cell to small cell type of lung cancer, and only a biopsy can tell you that. It does seem to be in a relative minority of patients that this happens, so it's rare. And there are some clues from CAT scans and clinical symptoms of whether this has happened. So in some patients, I think it's very important to get a repeat biopsy to determine that. In some patients, I think it's very reasonable not to get a biopsy because the cancer just doesn't seem to be acting like a small cell lung cancer would. It's something that really is very patient dependent and situation dependent, and something that I think is very much worth discussing, but is not necessarily important or necessary for every patient. In terms of for research purposes, I think it can be very, very important to understand what's happening in the cancer, and also potentially to guide a patient towards a clinical trial. So there are many trials now that are ongoing that are looking at the aspects in the cancer at the time of progression, and that only is possible if you get a repeat biopsy to understand those aspects in the cancer. And that really may guide us towards one trial or another, looking at different and newer, potentially better therapies. We don't know about that yet, but it requires understanding what's happening in the cancer to guide a patient in that respect of maybe this trial may be more beneficial than another trial or than our standard treatments.